My name's Peter Huxley. I'm Professor of Mental Health Research at Bangor University in North Wales, and I was a member of the expert panel on the Mental Health Integration Index project. The report itself, or the initiative itself, has a great strength because it's multidisciplinary. So it comes from a lot of different stakeholders, both at the policy level and academia. And that's unusual in that these kinds of things are more often than not produced by stakeholder groups who've got a vested interest in it. So I see that as a great strength, and it's a good lesson for everybody that you get sound and interesting results if you collaborate with one another in this way. One of the most important things for me is to put a greater emphasis on patient-recorded outcome measures. Only 7 of the countries that were reviewed in the project actually investing anything in patient-recorded outcome measures, so there's a long way to go in relation to that. The second thing is that because the employment is so important to the integration for the individual and for the family, we need to put a greater emphasis on employment-related projects in those parts of Europe that are not currently emphasising them. From the employment point of view, individual placement and support, which is IPS, is the best evidence-based intervention for people with mental health problems to integrate into the community and into work. It's travelled quite far. It's used certainly in Western Europe, but it's not. You could argue it's not travelled far enough, and that's something for the future that needs to be developed particularly in Eastern Europe. Part of the problem, not just in Europe but the rest of the world, is that services are so based on a clinical model and clinical improvements rather than social improvements, that services get judged on things like readmissions to beds and symptom relapse, where in fact if you talk to service users, what they're really interested in is getting their lives back on track and recovery. It's been a very exciting project, and I hope that people are going to make use of it, take it seriously, and both improve the data quality, the access to services, the employment services for people with mental health problems, so that they are better integrated into the community.